Hello, Global Health Leaders Conference community. The global health issue I want to bring to your attention today is the health crisis happening at our southern border. It is an issue that is less than 600 miles from where I am at, and I want to share with you why it is an important issue to address. But before I get started, a little bit about myself. My name is Hsiao, and I'm a rising senior at Sewardar Prep, located in the heart of Silicon Valley. I am the founder of Career Origami, an organization with an aim to help AAPI youth discover their career passions in fields such as STEM, law, and arts through the narratives from previous generations. I've also spent significant time learning about healthcare communications and public health issues with institutions such as Brown University and programs such as Stanford's Asian Liver Center Youth Leadership Program. I'm a self-taught guitarist and also a water enthusiast. I enjoy free diving, kayaking, and preserving coastal areas. Now, what I intend to do with the short amount of time we have together is to present to you the health crisis I see at the U.S. southern border. According to the World Health Organization, there are 1 billion migrants globally. That is 1 in 8 people, or about 12.5% of the 8 billion in the global population. The migrant crisis is an issue close to my home, and the number of asylum seekers arriving at the U.S.-Mexico border have increased from 16,000 in April of 2020 to 206,000 in November of 2022. It is creating an overcrowding problem at our border. And due to the influx of asylum seekers, the US and Mexico have inadequate resources to address and prevent the spread of diseases to an already vulnerable population. So, you may wonder, who are the asylum seekers and why are they at the border? Well, unlike 20 years ago where only under 10% of migrants were family unit members or unaccompanied children, today, over 60% of migrants are family unit members or unaccompanied children. They come from countries like Mexico, Guatemala, El Salvador, and more recently, Cuba and other Southern American countries. They're coming because of political, economic insecurities, violence, as well as environmental challenges in their homelands. The many stories of migrants coming to America are filled with danger, hardships, and sadness. Migrants travel thousands of kilometers through harsh and life-threatening conditions to arrive at our border seeking asylum. Going through the Darien Gap is one of the most dangerous migrant routes, not only because it is filled with natural hazards, but also because it is filled with criminal gang violence. As you can see, this chart is showing the migrant numbers at our US-Mexico border over the past 20 years, with the number of monthly migrants spiking dramatically from 16,182 in April of 2020 to 206,000 in November of 2022. That's a 1,200% increase. The drop in April of 2020 was due to the COVID-19 outbreak, and the subsequent spike was due to political and economic instability in Southern American countries like Ecuador. Currently, it is still hovering around 200,000 asylum seekers each month. With the surge in asylum seekers, U.S. immigration court backlog is at an all-time high, which means that waiting times for a hearing for asylum seekers are tremendously long. And so why is there a problem? Well, the surge and slow court hearing process is creating an overcrowding situation at the border. And with inadequate housing and other support systems, the situation exposes the migrant population with a wide range of health issues and mental distress. For instance, people have been bathing in rivers contaminated with E. coli, leading to a surge in the disease. In fact, 85% of asylum seekers entering the Juarez facility in El Paso have health problems during basic entry exams. Some of these diseases include cholera, tuberculosis, chickenpox, measles, scabies, and various eye infections. In addition to physical ailments, many refugees, asylum seekers, and migrants are also experiencing mental health issues. In fact, between 14 to 40% of the migrant minors suffer from depressive symptoms. So, why is this happening? What's causing the problem? Well, first off, these migrants are leaving their homes as a result of political, economic instability, and environmental issues in their home countries. Further, U.S. laws, facilities, and staffing levels are dated, inadequate, and simply unable to sustain the sheer number of incoming migrants. Finally, due to the sudden influx of migrants, nonprofit organizations are overwhelmed and are challenged to efficiently support these migrants and distribute resources. As members of a global community, it is our responsibility to aid and assist those who are underprivileged. We must keep in mind that these migrants are also people like us, and as such, are as every bit deserving of the care that we have the privilege to access. I'd also like to include a quote from Mohsen Hamid's book, Exit West. We are all migrants through time. There are numerous solutions that we can work towards to help with the health crisis. The visual you see here shows different efforts that we can take to address the issue. Some are more focused on addressing the health factor, while others are more policy-focused. And some efforts make a direct impact while others are indirect. For instance, you can see that writing to your local government regarding the issue is more of an indirect, policy-focused solution, whereas learning about mental health issues migrants may face is more of a direct health effort that you can do to help. For me, I plan to get involved with the Kino Border Initiative at my school. I want to thank the Global Health Leaders Conference organizers for the opportunity to share the health crisis that is happening at our U.S. southern border. I also want to thank the GHLC community for learning about this situation. For any questions, feel free to reach out to me at the email shown there. Thank you for listening.